Hello? Hello?
Hi, doctor.
And
Yeah.
you know the boss?
I think ماشي الحال. I think it's fine. هلا I was able to
بس تونشي اللي make the participant, the presenter, your, I don't know. So anyway.
Hello, it worked, Doctor. Thank
It
you.
worked? Okay, great.
yeah.
Yes, you can start if you want.
Sorry على confusion.
So Tanya is not able to join?
No, I think it's an internet issue. We can wait
Okay.
2 more minutes if you want.
I have no problem. I'm not going anywhere.
Yeah. So okay.
We should have some music. How about we have some waiting music?
We should. Wait, let me.
Okay.
It worked. Hello, Judy. How are you?
أهلا.
كيفك؟
أهلا. الله يسلمك. How are you?
الحمد لله. Good to see you. And thank you for joining.
Thank you. My pleasure, actually.
I truly enjoyed the paper. And amazing. Thank you.
Oh, okay. Great. Great. You were able to read it. Thank you.
والله بالعكس. I happen to be one of those منقرضين avid readers.
Yani, thanks to my co-authors, actually, who are actually with us today, Leah and Kamar.
Superb. يا أهلا وسهلا.
يا هلا
Hi,
فيك.
Dr. Alawi.
Hello, كيفك؟ ماشي الحال؟
Good. Yeah. Okay.
So
I'm glad
whenever
that
the boss, Diana, gives me a green light, we can start.
Sure. I think we should go ahead and start. Yes.
Okay. Perfect.
So I have a few slides, but they're all pictures. So
Even better.
I thought that might be an interesting take and things.
Okay,
so I'll share my screen whenever you're ready.
Okay, I'll start by saying a few words about you to introduce you to those who didn't get the full email, and then we will buckle up. Okay.
Yes, ready to lift off.
يلا. So you're recording and everything. ما هيك Diana? أو طالع.
Yes.
Okay. So good evening, everyone, and thank you for joining our Kawakib webinar series. I think this is Kawakib number 9. Against all odds, we are managing to continue one form of education or another. So today, it is really my pleasure to introduce a colleague I happen to work with a lot, and I know her dedication and her superb intellectual curiosity. So I'm very happy to have with us Dr. Jihad Makhoul, who likes to be called Judy, who is a professor and committee chairperson of the Department of Health Promotion and Community Health. teaching in the graduate public health program at FHS, which is the Faculty of Health Sciences at the American University of Beirut. Dr. Makhoul's professional life evolves from years of experience in non-governmental agency work in community health before coming to FHS almost 20 years ago, which is superb because once you are on the trenches, you get a really different look than when you are simply talking about matters theoretically. Her research expertise and interests lie in qualitative research methodology, social structural determinants of health, social exclusion, research ethics, and public health ethics. Dr. Makhoul has also recently become interested in studying commercial determinants of health and conflict of interest of corporations on humanitarian assistance and children. So please join me in welcoming her, and the floor is yours, Judy.
Thank you very much, Tala. I always like how you introduce your guests with this very personal touch, Islami. And thank you very much. It's a real pleasure and an honor for me to be speaking in this wonderful program and connecting with you and all the colleagues in your team, but also I want to say good evening to everybody and thank you everyone for joining. It's a pleasure to see we have a number of people here. Some of them are familiar names and others are new colleagues, inshallah. I'm in the Faculty of Health Sciences, and if you need anything, I'm available. My email is jm04. I hope we will be taking a very interesting journey together. I for one, had the pleasure of working with my colleagues, Dr. Tamar Kabakian and Leah Shaiban, on producing this paper, which has become a bit popular in different ways. So it's behavioral perspectives, I mean, this presentation, because we've been talking about why are people not doing what they're supposed to be doing. So we sat together and thought out some answers to this question. And so today we'll be talking about why is the public's adherence to the precautionary measures announced by the Lebanese state not uniform, given that what is required of them is very simple, seemingly simple. Physical distancing, proper use of facial masks, hand hygiene, and self-isolation. And these are called non-pharmaceutical measures or interventions. So they seem so simple. So we'll be trying to shed light on a number of factors that may tend when we point the finger at the non-complying individuals or groups in this pandemic. So we'll be using a social behavioral science perspective or lens and principles of risk communication to do this. So we'll be focusing on the messages and also the context within which these messages get propagated to understand the situation and hopefully try to improve, because we're having, repercussions, more peaks, but also we have a new phase coming on, which is the vaccination phase. And it's also important to remember that whenever we talk about behaviors, we might tend to blame the victim. So that session, we are able to understand that although behaviors are inherently individual, but they are affected by the wider context within which people live, work, and continue their lives. So I just want to first of all say that within, with the far-reaching COVID pandemic that we're living in, that started in December 2019. We have also witnessed a surge of misinformation that has taken the world by storm. And this misinformation has been coined by the World Health Organization as an infodemic, which is far-reaching and contains and spreads false information and different interpretations about the pandemic, its causes, ways of treatment. And this is spreading very fast, faster than the pandemic itself, and surely faster than the scientific information or scientific evidence about it. And this misinformation or spread of false or twisted or fabricated information could be intentional or could be unintentional. But it is taking the form of written communication, videos, pictorial messages, etc. Spread of misinformation in general is not new. It's very interesting to see that this misinformation had its ancestors in the 1800s, since the start of public media, published media, yani. Historically, it has been used to propagate information about different kinds of ideologies. And this information also, misinformation about diseases as well, is also not new. So as you see on the right-hand side, the Spanish influenza hit the world in a lot of fear among people, infecting millions of people around the globe, and also killing millions as well. So as you see at the bottom, I tried to, if you see at the bottom, the misinformation here about the Spanish flu is that it is a cold. So if you get a cold, you know, it might develop into a flu. So there was a lot of misinformation about new diseases that were coming up. And this was the case historically. However, this information today that we are witnessing is different from the misinformation spread, the ancestors, because of the spread within which it is happening, the speed of spread. And this is propagated by social media platforms. And these social and these messages, this misinformation and false statements, whether intentional or not, are made on televisions and social media platforms by celebrities, officials, and these people are sort of credible in their settings and in their countries. So among their followers and also by people around the world. So here you can see Nancy Ajram talking about the pandemic, Najwa Karam, and of course the famous ex-president Trump. So here we're saying that so what we're saying is that these measures that need to contain the spread of the pandemic are basically behavioral, right? So if they are behavioral, we need effective health communication strategies and risk communication. And these are important because they should be a part of the emergency response for public health. Because this is necessary to provide information that is useful, understandable, relevant to address circulating rumors, but to give people an understanding of what needs to be done to prevent the spread of the pandemic. And there are different ways or different approaches that one, that one can communicate information. And so there is this realist approach, and there's another social constructionist approach. The realist approach, as you can see here, is emergency risk. Is very objective. It is independent and not influenced by people's social surroundings within which it travels. So using this approach actually minimizes the effectiveness of the communication because it allows misinterpretation. And of course, in the midst of uncertainty of the and the emergence, continuous emergence of scientific evidence, as we know from health behavioral theory, that information alone does not is not adequate to change people's behavior. So this misinterpretation might work negatively against people's adherence or intention to change or to adopt these behaviors. So this realist approach has been used by the Lebanese government and a lot of governments around the world as well, relying very much on unidirectional and didactic provision of information about self-protection and flattening the curve. And this media. However, the social constructionist approach, which is the alternative way of doing things, draws the attention to people's social context and the importance of acknowledging the multiple factors that affect people's health, people's behavior, and their adoption or not of measures. So in Lebanon, we argue that the context is of interest because we're talking about the social context, political context, and the social inequalities. So I don't know if model, it has been used in psychology and sociology. We definitely use it in public health because it draws our attention to the myriad, multiple complex conditions that people live in, that people work in the country, in the community, individuals' health outcomes and behaviors. So the socio-ecological model actually tries to put these multiple factors into layers so we can see them and use them in our research or in understanding issues, but also in integrating these into interventions. So the Lebanese context, we'll be talking about the social context, the political context, and the multiple social inequalities. The collectivist society, Lebanon is a collectivist society. So what does that mean? Our society is collectivist, which is different from the individual. And here, social relations are dense and are key to survival, and social ties are valued and are necessary for economic and social support and individual decision-making and behaviors, and extended family structures and fictive kinship ties are abundant. Fictive, yani ties that are fictive kinship ties that are beyond the family. So you can call مثلا الدكنجي, the local shop owner عمو. It doesn't mean that he is your uncle, but this is a part of the fictive kinship ties that we have with people around us in Lebanon, because we are a collectivist society. So people live in close proximity to each other and obtain information more than other formal networks. And people also share good news and bad news. So privacy, the concept of privacy is alien to collectivist societies. And this collectivism has posed obstacles for physical social distancing and beneficial behaviors related to the pandemic. So the concept of personal space, for example, is alien to our society. So what does it mean to have distancing? So in places, and these are just some examples. So in Akkar, because people, the societies, people usually share and celebrate good news and bad news. So, for example, we all know of cases where one person was known to be negative. The PCR was negative, and there was a big celebration, and they got together and visited him in the house in the village, but it turned out that this man was positive later on, so that affected the spread of the virus. In terms of the beneficial behaviors, so we all know the story of Precautionary, where people got together later on using their communal ties to support each other and to support the municipality. And people outside were supporting their family members and the whole community for precautionary measures in Precautionary. And the area was contained and isolated, and there was a very positive outcome. So the second point I wanted to talk about is the political. The political aspect of our society. The sectarian nature of the Lebanese society has allowed religious sects to permeate political life. And we know that the Constitution allows this representation. And over the years and during the Civil War of the 75 and 1990, some of us weren't born there, but I lived through it when I was very young. So over the years, the state collapsed and this created a vacuum that was filled by the warring factions. And their warlords took over reinforcing and responding to this gap, and they created an unequal system of patron-client relationships, الزبائنية, clientelism, and social injustice and egalitarian context. So, amidst the social and economic problems in the country that we are all facing and are experiencing, and dwindling resources to respond to the pandemic, political parties stepped in to fill in this vacuum by, providing disinfectants to people, disinfecting the hotels that were receiving Lebanese returnees, and distributing personal items. So at the same time, we witnessed a delayed risk communication. So at the very beginning of the pandemic, we didn't know what it was. But state officials did not say that we don't know. And it was always, don't worry, nothing's going to happen. And so this delayed response by the state and you know, the problems that we saw with the consequent caretaker government officials. And we witnessed at the same time the contradictory and other media outlets that were propagated by the same people, by the officials who were telling us that we need to, you know, wear face masks the proper way, while and keeping social distance, while at the same time they were messages. So this we call this mixed or disaggregate approach increased people's mistrust and belief and disbelief that there is a pandemic actually going on. And then this was reinforced by media reports of crowding on the beaches and public places. The area is also with context, there are multiple inequalities and vulnerabilities. We can see now an increase in poverty among the Lebanese that is estimated by the World Bank to reach around 45% of the population. And at the same time, we have Syrian, Palestinian, Iraqi refugees who, together with Lebanese, have empty fridges. The refugees are socially and economically disadvantaged, and we don't need to talk a lot about that because we all know that they are suffering from multiple exclusion at the level of the social workforce. They cannot work in all jobs. They are discriminated by the law and live in very unhealthy conditions. And they also recently, especially the Syrian refugees, increased discrimination and persecution by some municipalities. This heightened their concerns about access to mobility amidst delayed coordination between the state and the UN agencies that take care of them. Also, at the level of the migrant workers, they are also at risk of exploitation and abuse, and many have been financial crisis because people couldn't pay their salaries anymore. And so this means that when they are left out in the cold, there is you cannot have social distancing, you cannot have masks, and they are deprived of livelihoods and financial resources for them to adhere to the precautions, given that some of them may not have access to internet where they receive messages from their embassies, etc. And we also know of the story of the Bengali workers in a local waste management company and their forced confinement in a building and spread among them. The last group that is of interest that to us while we're talking about inequalities here is the prisoners. And Leah found recently this Director General that says that we have a lot of positive cases in prisoners in Rumi, which is the largest Rumi and other places, other prisons that are very large, housing a lot of prisoners in in cells that are overcrowded. We have in Zahli 6 positive cases, Zgharta 10 positive cases. So it's enough to have 1 positive case in such overcrowding, and it's definitely going to lead to the spread of the pandemic. What's going to happen here? It's estimated 7,000 prisoners in Lebanon. There are 2,500 convicts, and the rest are just detainees. So these people are detained unnecessarily, and they are exposed and exposing others as well to the spread of the pandemic. Given that there is a lot of overcrowding and unsanitary living conditions, and of course questionable hygiene practices, water and soap and all of that. And I read recently, Kaman, that there's this big committee that's just formed to study how and to provide different kinds of services, and to try to reduce the number of detainees at least. And this was formed to include the local security forces, WHO, International Labour Organization, UNHCR, human rights groups, etc. So we have a lot of take-home messages, and I think I'll just finish with this. And this is our article. So this realist approach doesn't really work because it does not take into consideration the contextual factors that differ with different groups of people that are disadvantaged or not disadvantaged. So we need to be careful to consider this in the development of risk communication messages to increase the possibility of people adopting these messages. So we need to take into consideration how information is spread, what are the social networks, what are the factors, and what are the obstacles to access the information, but also to enact the information. And we need to remember that information itself, even if it is, locally, if it's produced in a locally understandable way, it's not enough to change behaviors. So we need to understand the profile of the audience and their characteristics a little bit more to tailor these messages to them, but also to use community any kind of adoption of behavior, of precautionary behaviors, but also to tailor the messages accordingly. And of course, prompt risk communication by the state is very necessary, as is the central role of the state in important. And so there are a number of other messages, but I just wanted to stop here and hope that we all remember that whenever we see individuals not taking the precautionary measures, to understand and to think beyond the person of the conspiring social context that they live in. The national, the community, and other social contexts. So thank you very much.
So, okay, thanks a lot, Judy. Very interesting talk. If I may describe it as a socially constructed realist talk. And I totally agree with you. One of the issue of trust with the government or lack thereof is extremely important. And I still get calls, even now that the government is starting vaccination, ideally next week, we still get calls as to whether we have a choice which vaccine to take and how to register, what about refugees and asylum seekers and migrant workers who cannot themselves actually go and register, and whether they have enough information in their own languages, particularly when we're talking in Lebanon, we are saying Pakistani, Ethiopian, Filipino, and Nepal. So this is a big issue. Now, I don't want to take long. I just want to ask you one question. One of the problems that we are facing, equally as noted, is a socially constructed one, is the fact that many of our Lebanese officials tend to come up with arguments and decisions without actually communicating with other ministries or without convincing them to reach one unanimous agreement on what to do. So you have one ministry saying one thing and the other one saying another thing, as if the pandemic is a different thing to each person. Wouldn't it be necessary, in your opinion, for us, say, for example, at AUB to begin with, to have an open letter signed by AUB people and maybe other Lebanese professors and what have you, asking them or highlighting these issues? I know that the government says refugees will be attended to, migrant workers will be attended to, asylum seekers will be attended to. How is this really going to happen on the ground? We have no idea.
Wow, that in itself, I think, requires or is for Talia. And I think our participants can also contribute to this. Just very quickly, clear, and based on what we were talking about today, we need to have a very clear, well thought through public health strategy that would take into consideration what needs to be done. There is a big team that's working, an advisory team that's taking on the technicalities and the logistics at the level of the ministry. And I know a few of our colleagues from AUB are there. So Anna, I would, the problem here is that what's happening is that this should be a systems approach, and there is very little public health thinking. So it's very much a medical approach or a security approach. So you don't see any talk about public health, a systems perspective. At AUB, we have the K2P, the Knowledge to Policy Center at the FHS, and I know they are on different kinds of products that would help officials think through what needs to be done in terms of مثلا responses, rapid responses. So I think في a missing في like maybe a bottleneck somewhere, or even that obstructs communication between us and the officials. So I think there are a lot of one needs to think about exactly what they are, but it's not rocket science. في كتير اشياء, there's lots written about that, and I know the K2P people And there are a lot of people come in the, in civil society who can get together and even come up with maybe an improved plan on how to do things equitably. And for the refugees, as I just suggested, the delayed coordination between the UNHCR and the UN agencies and the NGOs. We all know that work is abadan not coordinated, unfortunately, because everyone's doing their own thing and they're functioning differently, but there's not a central body that coordinates the work of the NGOs. They're allowed to mushroom here, there, and everywhere, even though there is a central some kind of work, but I don't know how effective that is. So, yeah, a lot of ideas, and I think that deserves, maybe we can open to the participants to give their ideas as well. But this just a few things at the top of my head about it.
Thanks a lot. Yes, I totally agree with you. So I'm going to give the floor to our participants, and my colleague Diana will kindly check if there is anything on the chat and coordinate this. So the floor is to the participants.
Okay, let me start with maybe a question myself. I know I often do that.
You took advantage of the situation.
Yes. Actually, it's two parts. So the first part, because you talked about the shaming approach towards the public, and I think I mean a lot of us are guilty of that when we see people not abiding or complying by the measures. However, what is your opinion or about the approach that the media and TV stations adopted? And because we saw really strong examples of this shaming approach, and how effective or ineffective is this in reality? And the second part of my question is, when we talk about the government and the awareness campaigns that they should have done, or the missed opportunities, would have like coordination with on the municipality level. I mean, I think that was maybe a missed opportunity there for a more decentralized approach to reach out to the community. So would that have been a better approach, maybe a more effective one?
Thank you for your questions. Very good. I definitely would agree with you with the this is a realist approach. Okay, so the realist approach does not take into consideration that people are resourceful, people can decide with the government. So this top-down approach of providing information and also providing fearful information, so high fear messages, they don't really, they don't work because instead of incentivizing people and encouraging people, we actually heard recently in one of the webinars here in the program, a speaker talking about shaming and blaming. So that has, instead of shaming them, encouraging might trigger positive feelings and reinforce, and this is an example of enabling factors. So let's all work with this together. And I remember that municipalities were not brought in to thinking about how it can be done and participating in the decision making, in the planning, in the monitoring and evaluation of all these campaigns or awareness campaigns, you want to call them, or information sharing. So definitely that is a missed opportunity. But نحن in Lebanon, we've always, unfortunately, used a very top-down approach to doing things. And it's about time, I think, now that we use a bottom-up approach where we integrate resources from society. And there are many good heads around that we can use. In terms of the so I think yes, I think yes, the victim blaming. The victim blaming is an ideology, and this victim blaming ideology, if people have it, I think people have learned to blame others for their own, or blame people for their own misfortunes. And this is a way of looking at things, but it has never actually helped in resolving problems, because problems are deeply rooted in the social context, the wider social context, in the political context, as you saw, and sometimes in the global context. So if we are aware of the root causes that has led to these, to HIV spread, to COVID spread, then we are at a better, at a better perspective and angle, and better and are more able to address the root causes. It's like, putting a bucket under a tap that's dripping. Well, why don't we fix the pipe? And then that you would resolve so that is working at a structural, at a societal level, rather than and you saw that we have a lot of victims here, a lot of victims. Look at the, people in jail, look at the refugees, look at the impoverished people, look at the daily workers. So there needs to be, the system needs to address these inequalities for people not to reach to a place where they, do not have the resources to enact the precautionary measures. I hope that addresses your questions.
Yes, thank you. Actually, that was pretty detailed.
Thank you,
I
Diana.
hope that. Thank you. So, if anyone in the audience has any questions, please go ahead.
Would like to hear people's voices different from writing on the chat. A very interesting global overview. You're very welcome. My pleasure, actually.
Anyone?
Any comments? Nothing.
Yeah.
Oh, nothing. ما هيقتوا ما في حدا.
Let me wait. I think someone has something in the chat.
Thank you. Very interesting. Thank you too.
Mm-hmm.
The article actually is is accessible. It's online, free. If people want to read, it's a nice bedtime reading.
Thank you. Actually, I have an additional question.
Yes, go ahead.
So I know that we're talking about contextual solutions and thinking about the context that we are in. However, can we look outside at examples that were effective and somehow get inspired by them? Are there, right now, looking around the world about the different approaches that governments use, has there been the best model that worked with respect to measures that were implemented for COVID, or is it too soon to tell?
No, actually, I think there are, as you call them, good practices. Take the case of New Zealand, take the case of other places in the world. نحن يعني عادة when you want to do an intervention, whatever it is, for whatever reason, for whatever health issue, you cannot, invent the wheel. You need to look into the literature or read more about what worked and what didn't work in different places of the world and build on that. And هلا في كتير, there are a lot of I don't like to use the word success stories, but there are stories that show you how the pandemic has been controlled. And I think if you look at that, definitely you will find that something has worked at the structural level, and there is always cooperation between local communities or local groups and the government or the state or whatever you want to call it. There is either trust in the system or support from the system for people. I mean, it's not going to work. In Lebanon, it's going to be really very difficult. I'm not a pessimist. I'm always an optimist. But given the current situation, you have lockdowns without people being supported economically. How are you going to expect them to stay at home? And the story goes on. So definitely there are stories that one could, or examples of countries, and so Khalij, I don't know details, but I know a lot of people who are there and just come back. And they say, well, we're doing what we're doing in the Emirates, for example. People are okay. People are wearing masks. There are rules. People are abiding by the rules, and everyone's okay. So it doesn't mean that that what's happening in the Gulf is exactly what we need to be doing here. The context, the situation is different. So we need to maybe learn and understand these stories within the context where they happen and learn from that rather than take as it is and apply Anna. So I stress the systems approach in understanding and intervening, and the collaboration in some places with people.
Mm-hmm. Okay, thank you very much for that.
Thank you. Thank you.
We actually have a question from the audience, from Khawla. And
yes.
She's saying, first,
Khawla always has an interesting question.
Yes, I think it's a very interesting one.
What is it?
So she's saying this is a very enriching reflection, and there is a lot to think of. You discussed the need for bottom-up approaches. How can the active civil society and volunteer groups in Lebanon participate on a community level for enhancing public health response preparedness?
How can they work in their own communities, you mean? Or right. Help the government?
Oh,
okay.
I think. Mm-hmm.
Let me just say a very quick couple of words from my point, and I know Khawla also might have some good ideas as well. A space needs to be created by the state for people to jump in and contribute with some good ideas, with their expertise, for them to feel that they are doing something for their own country and for themselves. People cannot be experts or professionals and blocked. They cannot be blocked out of the system. They need to be integrated, because this kind of expertise, like expertise in public health and community assessments, evaluation, systems thinking, health policy, and all of this needs to be integrated into the work of the government. At the level of community, sort of like neighborhoods or suburbs or smaller communities, there's always, you know, the municipalities or the mukhtar or people, key people, if you want to call them key persons. And I think key person, and they could be religious leaders as well. So there's a lot of mobilizing, community mobilizing that needs to be done. And youth can take a role in that. Youth clubs, groups, so you get the ball rolling, and there are ways of doing that. So there is a science behind that. It's called community organizing. So if you are able to do that, then you get people involved, and you can, you know, do a lot of wonderful things. But I think نحن بلبنان, many of us, you know, looking at the community, I'm in Kura, there's a lot of يصطفلوا or هو بيعمل هيك, I won't. So it's like relying on other people to do your own thing, and it's not a simple answer, but it's complex. But I think people have not been used to doing things not for themselves, but for the others, for wider community, because we have not been incentivized to do this over the years. So I think there's a lot that can be done if one you know, understands the context and how things work, and work with the municipality. You can get some good ideas, and it won't cost a lot of money. And I know a lot of youth groups who are very active, scouts, nawadi, yani clubs, and I think there's a lot that can be done.
Yes, thank you. Actually, I do. I agree with you with regards to the, I mean, how much can be done at the community level, but on the other hand, we don't want to get to the point where we're relying on the initiatives of the community to shoulder the responsibility instead of the state. So I think maybe that's a bit of a
Yes. There needs to
delicate
be strong coordination, and there needs to
Yeah.
be leadership at the level of the state. If leadership is absent, this is what's happening. So,
And it is absent, unfortunately.
you know, I what can I say?
I know. Any other questions or comments? I want to
no,
respect all of the time. Okay, perfect. Julie, thanks a lot, really a lot.
My pleasure.
I learned a lot.
Thank you, everybody.
And I hope we will have you again on another webinar with us.
My pleasure.
Have a good evening, stay safe, and thank you all for joining. Thank you, Diana.
Thank you all very much. And I just want to thank Andre for helping me with the PowerPoint. He's my godson, and he's with us now.
Superb. Thank you,
and take good care, everybody. Thank you very much. Thank you, Tala, and thank you, Talia and Tala and Diana for your support.
Thank you.
Allah yaqwikum, and good evening. Thank you.
You too. Bye-bye.